Greetings, everyone. Today we are discussing a very interesting topic, that is turnaround time, what the intensivist should know. And Florence, Nambaziira Muzaale. I'm a laboratory professional, and I work with MRC as the head of labs. Turnaround time is a crucial topic to discuss because it affects the quality of care. And this, as our theme goes this year, critical care and essential pathway to achieving the sustainable development goals in Uganda, it is important that we all really consider it as an important thing in our medical service. For us to proceed with this presentation, we must understand what turnaround time is, because people define it differently. So turnaround time is the time interval between reception of the samples in the laboratory to the time of reports, when the results are verified and dispatched. In most cases, people only consider the examination process when the sample is being analyzed by the machine. And they consider, in a CBC machine, it only takes 5 minutes. But it covers a number of processes from pre-examination to examination and then post-examination. What must the intensivists know? That the time in a test takes has to be defined by both parties. Just agree that for our particular setting in here, the time will be, for CBC, will be 10 minutes, and we all agree after going through all the 3 processes. That is from pre-examination, examination, and post-examination. The laboratory has a number of quality indicators that it measures, and some of them are the quality of the results, the downtime of equipment, and turnaround time is one of the indicators that often define the efficiency and effectiveness of the laboratory. So punctuality is very important in ensuring the right quality care of the patient is provided. And one of the things that the lab users always complain about or appreciate about. If the laboratory is consistently taking a lot of time to give results, the users will always complain, and it affects the quality of the service provided. And if the time really that the users and the laboratory agreed upon is met, it's a good indicator that the laboratory is providing the required service. I just wanted to share with you just a few examples of the turnaround times and usually the criteria that they consider. Why would consider them to be done on time? Yeah, and one of them is CBC. Yeah, why would we need to have a CBC done on time? Before the treatment is given, the doctor should be aware of what condition the patient is going through. The blood slide. Yeah, most of the causes are due to of infants or children are usually due to malaria. So if a result delays, it really affects the outcome of the patient you are taking care of. Yeah, blood group, HB, stool analysis. So all these tests, they are those tests that really considers urgent and they should be analyzed on time, and the times have to be agreed upon. For instance, if a routine test takes around an hour, and then if the critical or the intensivist has defined that for our urgent requests, we want this to be less than an hour. So we have the routine turnaround time, and then the urgent or emergency turnaround times. These have to be clearly defined between the lab users and the lab team. So in this case, we are looking at turnaround time in regards to critical care. But for you to be able to define the turnaround time, you should know, or we must be aware of what is critical care. So critical care is a medical condition for people who have life-threatening and illnesses. And if not really taken or considered urgently, they can cause challenges to the care being given to the patients. So it's very important that when you are taking care of our critically ill patients, understand that this is life-threatening and can lead to death or complications. The time must be clearly defined. And this is the time from when you are receiving the clients to monitoring for any improvement. And this, all aim is to prevent death. So the role of the critical care team is to ensure death is prevented and other comorbidities are prevented. So the laboratory must be part of this special team the critical care team, to ensure that results are released on time. And the intensivist should clearly indicate that this is a critical patient. We have those walk-in patients, those are routine, and they can get their results on the next day. But for critical patients, this should be clearly indicated. And I would emphasize if we can have special stickers, either green or red. Usually red is better to indicate the urgency of the test. We are dealing with a critical patient, and this is what we need. So that the critical patients are catered for differently from the routine clients. So that's why it's very important for the two lab and the intensivists or the lab users to be in good working relationship to ensure all this is defined. And the team of the laboratory should be aware that there are critical instances where it's a matter of life and death, and they should really up their game. So the laboratory initiates the critical procedure, such as running the samples in a start mode. Our intensivists should know that these machines are also programmed, because usually the work we do in the lab is more of using machines. So our machines are also programmed, to have what we call start mode. In start mode, all emergencies, and as long as you click start mode, then the machine will leave all the other routine samples to cater for this routine sample that has, for the critical sample that has come in. As long as the request form has been fully labeled that this is a critical patient. What the intensivist should know and really consider as we are providing quality care for our critical patients, they should work in conjunction with the lab team to have all this established, the time and what we consider critical. Because you can consider something critical when actually it is not to other conditions, depending on the condition. So critical values differ with the condition or medical condition or the kind of infection that you have. A high bacteremia can be indicative of probably something is going wrong in the blood, or somebody has a wound or anything. So it is very important for the critical team and also the intensivists to know, to define what is critical. And after this has been defined, then we attach time to it. And this has to be followed. And if this hasn't been followed, then the two parties still have to come back and agree during the meetings, the critical care meetings or comorbidity meetings or mortality meetings, that such and such a patient was not cared for well because the result delayed, or this death wouldn't have happened, or this patient wouldn't have gone into coma, when all these were fully defined by the two teams. So if not established, life-threatening conditions can happen or death. So need for urgent preventive and corrective action. What is preventive or what is corrective? That preventive, we want to look at those processes that will help us to prevent particular condition to happen. So prior, for anybody else to fully understand what is to prevent, they should know, have a risk assessment. For instance, if we had this patient with this particular condition, what should we do? So, and this should be shared between all the people involved in giving care, not only lab and intensivists, but also maybe the nurses, the pharmacy, that when we get such a client, or rather their guidelines, this is what we do, and these are circulated in all the departments concerned. And this clearly indicates when we receive such a client, this should be followed. And in case something goes wrong, this is what we should do. So all preventive and corrective action should be earlier planned to prevent any death or other complications to develop. This is similar to the slide that I shared previously, showing the different turnaround times. And this, we are dealing with critical. I'm only not sharing more of routine. I'm looking at things that are really running out of hand, that are life-threatening, that can cause other comorbidities or death. So the clinician or the intensivist should sit with the team and agree on what is critical to them. So if probably you see a malaria plus, this should be critical and the patient should be handled like this. If we see a CBC indicating this particular cells, it is critical. If you see the same group, most especially for the mothers, the pregnant mothers, if you see the mother is reacting on the same group, yeah, blood group incompatibility, start to suspect something. What is happening? Are we dealing with the hemolytic disease of the newborn? Are we dealing with the rhesus factor? What are we dealing with? If it is HB less than 4, the lab is very critical and fundamental in ensuring no death should occur because of low anemia. And if these are defined, anybody else in the lab, when they see something below 4 or at 4, it is an indicator this is a critical patient and results should be dispatched to the doctor or to the intensivist as soon as possible. So our dear intensivist, it's very important that these are defined very clearly. For instance, in this current state of COVID-19, if you see a result comes back that this is COVID, there is a positive swab, COVID-19 is in the presence of COVID-19, it's very important that the lab communicates the results to the caregiver as soon as possible to avoid infecting the other people and to allow this patient to be in isolation and to be given the right care. It is very useless for us to get a result of low HB after 10 hours when actually the patient is in the mortuary. So the issue of critical care and turnaround time are very important in ensuring preservation of our patients' lives and prevention of death. And as our millennium goals are improving the health of our people, it is important that the care we give to our people is really good to avoid anything that would come in and affect the lives of the people that we would take care of. And if somebody gets an abnormality or a disability after a delayed treatment, definitely this person will not be able to be productive, and this affects even the economy of the government or the state. So giving the right care to our patients is very important. So what is the purpose of timely care, yeah, in our critical patients? Yeah, some people may not know why is it that the doctor needs these results very fast, yeah? Why is it that they are putting lab on pressure because we have a patient with confusion and what things to be done on time? I think it shouldn't be a pressure thing or a blame thing. When all these are defined between the two departments, that this is critical and this is the time it should take, the end result will be good clinical decision. Yeah, we'll be able to know, yeah, this patient came in with seizures. The lab was able to give us results for electrolytes. We're able to give the right treatment and the life of the patient was saved. And this will, at the end of it, minimize the costs of care. Yeah, we are looking at giving affordable quality care to our patients. And then also not wasting a lot of still time and money, yeah? Because if you're not giving the right treatment, so the doctors will continue asking, one doctor comes request for CBC, another one comes request for electrolytes, then this take an hour, then another doctor still requests for CBC. So if the first time the doctor requested or the intensivist requested got the results on time, there would be no panic. But it's very hard to manage a patient when you don't know what is really happening in that patient. So it is very important for all of us to really understand the importance and relevance of quality care and timely care when we are giving, when we are providing the care to our patients. So in this presentation, I also wanted us to look at what are the usual causes, yeah? Being in the laboratory setting, what are some of those usual causes of prolonged TAT, yeah, that we should consider? And if we already know that this causes the prolonged TAT is the turnaround time, what should we do, yeah? So some of them are quality assurance processes, yeah? The lab has to go through the maintaining of the machines, running the QCs, the calibrations, ensuring the result is of quality. That the intensivist should really understand, that the laboratory cannot issue a result which they are not sure of. So when we are defining our time, the turnaround time, yeah, this should be catered for, yeah. And then equipment downtime. Yeah, this is when the machines are down. Yeah. What happens in case there's equipment downtime in the laboratory? Yeah. Then stockouts, manual methods, unavailability of personnel, or increased workload or interferences. Yeah. And all this will lead to late treatment, drug overdose, or wrong treatment given, increased treatment cost, and increased risk of developing complications, and then the last one, death. So what should we do now that we know some of these things affect the turnaround time and the care of our patients? We want to give quality care. We want to give care on time, but not compromising quality. So what should we do, and what should the intensivists know? Yeah. For us to be able to fully define our turnaround times, there should be better and good records that act as a basis to inform the caregivers where that delay really takes long. Yeah. And this is what I have called turnaround list. It should be a record that captures information. This sample was removed at this time. It was this particular test, and it took this time for us to get the results. Yeah. And probably we can have a comment. These were delayed, or these were not delayed. At the end of it all, it helps us to analyze the kind of care we are providing. Yes, I've also been mentioning about critical results. We should also have a list of what we have defined as critical. In case of an accident and you get an HB like of this, or CBC, which is like this, or malaria, which is like this is defined as critical. Yeah. And then these registers should be both at the laboratory and then also at the intensivist table, or the lab users table. I can give an example of theater. Yeah, they requested for blood for transfusion at 10, and they received it at maybe 2. Yeah, so that record should be there and easily followed. Once all that is in place, the lab team and the intensivist should have regular meetings, yeah, to check on the performance of these quality indicators. As I indicated, turnaround time is one of the quality indicators. And laboratory should inform the team they work with on what has affected their turnaround time in a particular period. If it was equipment breakdown, what should they do? Should we have a backup machine? If it was a stockout, was it because of the lab, or was it because the supplier? Then think of having a backup supplier. And then also during mortality and morbidity audits, the lab should be involved, because these are learning areas for their weaknesses and then also upholding on their strengths. Yeah, in the previous slides, we have seen what really causes prolonged turnaround time, and one of them was equipment downtime. Yeah, so what should we do? So there are gadgets that the intensivists can use, yeah, before to mitigate the issue of downtime. If the main machine of the laboratory is not working, then we should think of an option, because we want to ensure the lives of our patients are really saved. The right care is given on time. So some of the things to consider as intensivists is the point of care gadgets in our small units. Some can call them side labs. Yeah, it is important we have a small section, very small, it can even be a table. Yeah, having those small gadgets where you can do a quick HB, a quick glucose test, a quick blood gas, that you don't have to send samples to the lab. Yes, you can send the main sample as other analyses are going on, but it's important we have this point of care equipment that is able to perform those tests that we consider urgent, the lactate, the glucose, the oxygen levels, all that. Yeah, and these have termed point of care. Yeah, results are received on time. Yes, they are portable. Even in theater, you can go with it. Anywhere you can move with it. It's convenient, speedy, and you can easily train people on how to use it, and to use as little quantity blood samples. Yeah, so it is important that much as we have a main lab, yeah, intensivists should start planning for those that do not have these small side labs for quick testing. Should start planning and having those small point of care. Yes, small point of care equipment where you're able to do the testing. They are portable. Anywhere where the patient is, the machine can be really taken and result given. So this is quite a busy slide, but it's showing some of the examples in case there's a delayed care given or delayed testing. One of them can be hemolytic disease of the newborn if we delay with results of compatibility testing. And then anemia in pregnant women, this can cause miscarriages. Delayed results of COVID, can cause delayed isolation and spread of the infection to the community. Elevated troponin levels, this can lead into cardiac arrest if not really identified very fast or detected very fast. Raised D-dimers in cases of DVT. So if the lab is able to detect this as soon as possible, then the intensivist is able to work on the clots and no death can occur. Delayed malaria with hyperasthenia, this would, if the results are given on time, wouldn't be having issues of cerebral dysfunction or permanent dysfunction of the person affected by the malaria parasites, and even some die because by the time you see a high hyperasthenia, malaria anemia will also kick in, and then the issues of blood shortage and set in, and this causes death. Elevated INR, elevated potassium. By the time you say high potassium, you know something is happening and can lead to death. So these are just examples that we really look at, and I've decided just to pull out in case the result is delayed and the intensivist is not guided on what is happening, then it would lead to death of our patient or taken care of. So this is a summary of what our intensivist should know. One of them is building rapport with the lab. Please do not go to the lab when you're only complaining. It affects performance, yeah? And every time they will say particular intensivist, they know that one has come to complain. So it's very good to build rapport between the lab team and the intensivist. Give them good feedback where it is due, and then if it's not good feedback, still find a way of communicating, because remember, we have already had a prayer meeting and defined our times and defined our critical values, what is critical, in what condition, and what is not critical. So it's very important that we all understand our processes. The intensivist should understand the lab processes that lead to generation of a quality result. Have regular meetings to understand the factors that have affected turnaround time. Have communication platforms, yeah? There should be platforms that combine the lab team and the rest of the hospital team. It can be a WhatsApp group. It can be an email group where in case anything happens, an email is sent. Yeah, we were dealing on this particular condition and the patient died. So you carry a simple audit before the general one, yeah? And then the contact of key lab people, yeah? Intensivists should know who is the lab manager, who is in charge of chemistry, and they should demand for that list in all critical areas. If I'm dealing with a blood shortage, whom should I contact first, yeah? If I'm dealing with something with chemistry, who is the contact person? Not to wait when there's crisis, we have a critical patient, then you want to get the contact of the lab manager, you don't have it, you don't know where it is. This should be pinned somewhere in our critical areas for easy communication in case of anything. And then I've already talked about the critical results and the turnaround time therein, having point of care machines for quick clinical decision as they await for the lab report, and then have processes in place that define what is critical from routine and have alert stickers. So this year's theme is on meeting the Sustainable Development Goals, particularly in Uganda. And I really wanted to look at how we eradicate poverty and hunger, guaranteeing for a healthy life, yeah? For us to have healthy people, yeah, they should be cared for very well. That's why this conference has come in timely, because if we ensure that the life of our patients is good, the right care was given, they will be healthy, they will be able to go back and dig or do their businesses, we shall be able to fight poverty and hunger. But if we had a delayed result, probably malaria one, and somebody got a cerebral problem, they're unable to perform And trust me, if the breadwinner, the poverty and hunger can never leave that family. The children will not be able to go to school. Yeah. So it is very important that we consider giving the right care to our patients. So ensuring the well-being of our population through quality, the care given should be of quality, should be affordable, and the sustainable medical service delivery. The health workers or the health givers should be available, not to have a patient come in and the intensivist is not available, the lab person is not available. So our key interest should really look at reduction of maternal and child death. Yeah, most of the deaths in Uganda are attributed to the biggest percentages because of our children dying before the age of 5 years and pregnant women, and they should die because of preventable conditions. Yeah, preventable. So if we could be available and have the results provided at the right time and the right care, timely diagnosis. If it's malaria, it is malaria, no wasting a lot of time. If it is hemolytic disease of the newborn, it has easily been identified, the mother given the right treatment, and the baby after birth is given the right treatment. Timely treatment, but of quality, would save a lot of Ugandans from death, poverty, and hunger. Yeah, this is just a slide showing the different Millennium Goals at a glance. And I was really zeroing on ensuring the health of our people. That is goal 3. But after achieving goal 3, then goal 1 and 2 should not be really a problem when our people are healthy. Yeah. Conclusion. Yeah, it has been, I think, a long presentation. For good patient outcome, a timely intervention in care for the critically ill is of paramount importance as we work towards saving the lives of Ugandans and meeting the 17 Sustainable Development Goals. It requires a concerted effort and collaboration of the laboratory team and the critical care team. Yeah, that is it. I want to thank you so much. And during the question and answer sessions, I welcome any questions. Thank you for being good listeners.